Well, karibu sana. This is Morning Cafe. I'm used to Stanley Nyerengeti. It's a Monday. We're discussing matters health, and this conversation for today is one that really touches quite a number of probably your mother, your sister, your wife, or someone you know, probably a friend. We're discussing uterine fibroids and what you really need to know about it. We have a specialist for that. Quite the experience. We're really lucky to have him for this conversation, and we're asking you, do you have any questions regarding uterine fibroids? You probably heard of some bits and pieces here, hapa na pale, around your family circles, and you really want to clear the air when it comes to this conversation. We're giving you that opportunity for the next 1 hour. We're opening the phone lines for you. Yes, 0795 045 864 is the number to call us live, and Terry will be answering all that. But you feel like you don't really want to, ask to hear your voice, you can also text us. 0793 267 279 is our WhatsApp number. You can also text us there and text us your question, or rather even your opinion. And Dr. will be giving us the opinions on the same. And the Dr. that I'm mentioning quite a lot is Dr. Stephen Ngigi. Quite the experience. He's a family medicine specialist, as well as a medical superintendent, Maragua Sub-County Hospital. That is just a nutshell of his many years of experience. Karibu sana Daktari. You can also, tell us how many other accolades are on your plate.
Well, I am a senior medical specialist, deputy director of medical services, and I've been practicing as a primary care specialist in Murang'a County, Maragua Sub-County Hospital. And during the years I have been there, I have observed an increase in number of women of reproductive age who are presenting to us with this condition that we are discussing today. We normally refer to it as uterine myomas in our terms.
Right.
But you can still refer it as fibroids.
Okay. How many years have you been in the practice?
I've been a deputy director. That tells you I have been there for quite some time. That is 25 years of experience.
20, wow. That's almost all my years now.
Yes.
Right. So now the reason I'm asking that is because so over the 25 years plus, there has been a trend in how even the data that uterine fibroids has, there has been a trend, and there has been changes. You'll be telling us when you're starting out, what you are seeing, and right now what you're seeing as at 2024. But before we get into the gist of that, for someone who's even seeing these two words for the first time, uterine fibroids, help us understand, what are they, what is even the main cause of it? Is there actually a cause?
Well, most of these are idiopathic. There are no known causes. We can only look at the risk factors, especially women who are obese, and women who have a BMI more than 30 kilograms per meter squared have been shown to have a higher predisposition, the black population, and people who have a leaning on high-calorie diet. Of course, these are the obese people. They have been shown to have a higher predisposition to developing these uterine myomas. And also to say that these are benign lesions, they are non-cancerous, but of course they can become a nuisance because they cause heavy cyclic menstrual flow or bleeding, which we refer to as menorrhagia.
Right. You've mentioned diet, and quite a lot now will be really curious when you mention diet, because probably someone has a specific diet, but then at the end of the day, they still have fibroids, and they're wondering, or rather someone is on a particular kind of a diet and they're wondering, am I actually on the right path to not having fibroids? What's the ideal kind of a diet that may not actually, let's say, trigger fibroids?
Well, one of the important thing is we emphasize on a balanced diet, because people who have uterine myomas tend to bleed and are anemic. They are fatigued and their bodies are weak. High-calorie diet is a diet rich in carbohydrates. It tends to be a diet rich in highly refined sugars, rich in sucrose, icing sugar, things that people like taking, like chocolate, ice cream, and as well as fast foods. fast foods, including things like chips, chapatis, mandazi, all these things that we're able to take as, we normally say they are snacks, but we tend to overeat them. They predispose people to obesity, and I have said obesity is a risk factor for developing these benign myomas. We look at our traditional foods that we call slow foods. Slow because they take time to be digested and metabolized. Traditional foods also contain sugar, but it is complex, meaning that it takes time to break it down in our bodies, such as cassava, things like arrowroots. These things we rarely eat now because people have become modernized and prefer to eat chips, chapati, and rice at the expense of those traditional foods. So we have a feeling that probably it is good to study the role of diet in these patients who are becoming obese, because there are comorbidities to these lifestyle diseases, such as diabetes, type 2 diabetes, is also quite common among these people who are presenting with myomas.
So if someone now fits and they're listening to you and they're saying they actually fit whatever you're describing, the kind of diet that they have, and they're taking a look at even their weight, the height, the BMI that you're telling us, they're saying I'm actually obese, but they haven't experienced, let's say, any kind of symptoms. So what are the symptoms really to watch out for?
Large numbers of these patients are asymptomatic, save for the fact that they might notice an increase in their menstrual cycle flow. It might be heavy. In some instances, it might interfere with their lifestyle, their psychosocial status, and all that. And that is when now they might come to the hospital. Others will come to the hospital because they are unable to conceive. Other patients will come to the hospital because they are conceiving, and then they keep having miscarriages or pregnancy losses. And that's when they will be screened, and a routine pelvic ultrasound scan might pick out leiomyomas. Leiomyomas can be submucosal, meaning they are just at the lining of the uterus, and those ones will be associated with the pregnancy losses, as well as the heavy cyclic bleeding, which is menorrhagia. They can be intramural, meaning inside the wall of the uterus. They can also be subserosal. And in some instances, you can have them having appendicle, so they are pedunculated. And they can also develop at the lower part of the uterine segment and prolapse into the cervix. With, of course, those ones who present with prolapse fibroids have heavy bleeding and severe low abdominal pains, backache, and of course fatigue because of the severe anemia. So it's a medical emergency.
So now out of the types that you're listing, which is out of the many years that you've interacted with the fibroids, what's the most common type of fibroid that would be experienced in a number of ladies?
It is the asymptomatic ones. Many of them don't even know they have them. You just pick it on routine ultrasound scan or a routine obstetric scan, because they can still conceive with these fibroids and continue on with life. Save for the issue of heavy menstrual or cyclic bleeding, these ladies, most of them are able to live without having major symptoms that would actually necessitate them to come to the hospital. So during routine ultrasound scans, you see them there and they are asymptomatic. Yeah.
Also, so now let's go as young as, for a girl who's as young as, let's say, 11 years old. In your years of experience, for a girl who's probably started menstruating when she's probably 11 years, is she at a higher risk of getting fibroids rather than a girl who started at around age 13? Does the age factor matter when it comes to starting out on the menstruation?
Well, obesity is an issue also in adolescent medicine. And when you look at these young people who are tending to have what you are describing, early onset of menarche, these girls may be obese. Probably they are the ones who are eating high-calorie diet foodstuffs, the ones we have talked about. So they could be actually at risk of developing the uterine myomas later on in life. And actually we are seeing a younger population of people presenting with the same condition.
Right. So even before you continue, just a reminder also to those who are watching us, wherever you're watching us, 0795-045-864 is the number to call us live. You can have it on the screens, and you can call us live and ask Dr. Ngigi all those questions that you have concerning uterine fibroids, just to clear the air on what you've probably ever heard about this whole bit. And so so far, Dr. just trying to and elaborating what it really means. You've really, talked about even those who are at risk. We can also get into, let's say, the triggers of the same before we actually now get into, matters of treatment and really dive into that.
Well, the triggers of complications or the symptomatology of the illness, for example, if someone has a submucosal fibroid and for some reason they conceive, they might present with heavy bleeding, early pregnancy loss. Other people might present with the issue I have raised of recurrent miscarriages. Patients may also have chronic low back pain, pelvic pain. They may have frequent passing urine, especially if they have a huge leiomyoma that is sitting there on the bladder. They may have constipation if they have got penetrated subcallosal fibroids, which are also pressing on the GI tract. And most of the time, they have abdominal fullness, they may lack appetite. So the symptoms are not as clear. I have just said that it's usually on a routine pelvic examination. They might notice an obvious lower, pelvic swelling. In some communities, and most of the time, you will see people seeing a woman with a swelling, especially with the huge leiomyomas, and they think they are pregnant. And so they could be waiting for that baby for years, even going for prayers to have the baby. And eventually somebody might refer them, because we do have a lot of community health promoters, and we do have also networking with the church. And so when they go there to pray, they are prayed for, but referred to us. During that time, then we do our history, we do our physical examination, and a routine pelvic scan will tell us that they're actually having a leiomyoma.
Right. And our offline banter before you actually came in, you're telling me that historically a number of cases were resonated with the nuns and all that. Why is that really?
There was an issue of nulliparity, which is also a risk factor for developing uterine myomas. And so that category of people you are referring to were not supposed to have babies. And for some reason, also because of dietary changes, they were predisposed to developing leiomyomas. Because most of the time, our people are taking high amounts of high-calorie diet, highly refined sugars. They like eating what is tasty and what is appealing. And traditional foods are not as tasty. Cassava and pumpkins
it's definitely
are not very tasty.
The tongue.
Yes.
But then, so does that now mean the kind of lifestyle that this nun has chosen definitely resonates to, let's say, a number of ladies out here who say until they reach a certain age, where they now start having that conversation of having children. Is that a particular limit that you'd probably be advising a lady that if you don't start thinking about having children at this age, you might be at risk of having fibroids?
How I look at it is the preconceptional care and counseling A lot of people are not planning that, and many people go to the antenatal care very late after they have conceived or when they have had recurrent miscarriages. It would be good for these people to visit their nearest health facility for preconceptional care and counseling. During that time, routine tests can be done, which will include a pregnancy test, a full blood count, what we call a complete blood count, because sometimes bleeding could be associated with coagulopathies or other breathing disorders. Rhesus factor is very important to know because rhesus negative women will need to be taken care of so that we don't have problems. Because if they are conceiving with fibroids and having miscarriages, then we shall have a problem with the next conception and also the babies that they will have.
Right. And actually now on that, because a number of ladies would really want to ask, as much as, wengine labda hata wanaogopa kuuliza hii, and I'll ask on behalf of them, so can I conceive if I have or had fibroids or have ever, or actually I'm actually being told that we do have a call. Who am I speaking to?
Hello.
Hello, habari asubuhi.
Naitwa Jacqueline.
Okay, Jacqueline kutoka wapi?
Mwea.
Habari asubuhi Jacqueline, tuongea na sisi.
Nilikuwa nataka kuuliza kama kuna station inaweza tokea na sisi tuko na boss. Lakini ukipima inatoka negative. Na niko na sensi zote.
Okay.
Alafu kuna uchafu inatoka.
Unataka kujua hiyo situation ni gani Jacqueline ama? Sawa, asante sana Jacqueline kwa kupiga. Actually atakuwa nakuelezea saa hii tu.
Sawa.
The ball is in your court now.
Yes, I think she's discussing infertility. It could be secondary infertility. She's saying that she feels like she has all the symptoms of pregnancy. And those are the people who should come to the hospital because there are differentials to the symptoms she could be having, in quotes. If she's having nausea, vomiting, we have said the myomas can be pedunculated, can be subcallosal, can cause symptoms of abdominal fullness. They can cause constipation, increased urine frequency. And that's why I've said such a person should come to the hospital where we do routine pregnancy tests, a pelvic assessment, a CBC count. We also do a high resolution ultrasound scan. In some instances, we can do a hysteroscopy. We put a camera in and see what is going on there. So this is somebody who could be having other conditions that can be associated with infertility, such as hyperprolactinemia, some medications that people are using, for example, antidepressants and drugs like antiemetics, could predispose them to hyperprolactinemia and also interfere with their ovulation cycles. So they could be thinking they are pregnant and yet they are not. Okay. So they need to come to hospital.
Right. Jacqueline, hope umejibiwa hiyo. 0795045864 is the number to call us live. It's just below your screens at the moment, and you can call in live. Dr. Ngigi will be answering all your questions, or if you have an opinion on the same, you probably want to also share your experience with us and tell us how it has been, or maybe someone you know. 0795045864 is the number to call in live. And because you already got into the whole conversation of conceiving, was something that I was asking before she called. For someone who has the fibroids and they're probably removed, and the biggest question in the mind is, can I conceive after I had the fibroids? Is there a possibility that they will reoccur? Walk us through all this.
Well, I have just said that people conceive even with fibroids, and they can carry pregnancy up to term. But this is a high-risk pregnancy, and therefore they need to attend a high-risk antenatal care clinic. They should be attended by the specialist, and they should deliver in a hospital which has comprehensive obstetric care services. A level 4 hospital where there is emergency blood transfusion service, and also a hospital which has got emergency cesarean section services. So that is very important precaution, that they should not just try to deliver in any facility. The other thing about these people is that when they are removed fibroids, either they are removed laparoscopically, they could have been removed because like the prolapse fibroid, it's possible to do a speculum examination. You can see it and it's possible to remove it. Or they could be having an endometrial polyp, which can also be removed through a hysteroscopy.
Could I kindly interrupt you as we pick this call? I believe Dorothy kutoka Tharaka Nithi.
Hello.
Yes, habari asubuhi Dorothy.
Salama sana.
Uko na swali au maoni?
Mimi niko na swali.
Yes, tafadhali.
Kwa daktari. Last year mwezi wa 5 nilifanyiwa myomectomy. Hiyo nilikuwa kutolewa fibroids ambazo zilikuwa zinanisumbua for a long time. Na sikuwa najua.
Okay.
Sasa nilikaa nazo kwa a long time sababu niko na mtoto mmoja na nilikuwa najaribu kuconceive tena ikakataa. Sasa ni baadaye sikuwa naumwa nikaenda hospitali.
Okay.
Periods zilikuwa ziko
Right.
Sasa baada ya kwenda ndio nikagundulika kwamba I have the fibroids na nikafanyiwa hiyo myomectomy mwezi wa 5.
Okay.
And then mwezi wa 10 nika conceive na ile mimba ikatoka.
Okay.
Sasa swali langu kwa daktari ilikuwa je, after the operation ama the so-called the myomectomy nitakuwa nikae muda gani kabla ni conceive? Na je, saa kama hii natakiwa nifanyeje maybe ku conceive? Yeah.
Okay. I seem to all right. Thank you very much Dorothy kutoka Tharaka Nithi pale. I believe you've got her question. Yes.
Yes, she has one baby. She has had myomectomy. She conceived and then she lost that pregnancy. It's unfortunate. I think she needs to go back for a re-evaluation or a checkup where a simple higher resolution ultrasound scan of the pelvis will be able to tell us whether there are other fibroids that could have developed in her uterus. The other thing about conception after myomectomy is that she should completely heal, because we expect the uterus to be able, is an organ that is able to recover and fully develop to its normal form after myomectomy is done within a short period of maybe 6 to 8 weeks. She needs to go back to her doctor so that they can do other evaluations, because we might assume the cause of loss of pregnancy was just because of the issues of fibroid, but she could be having other conditions. So she can be done other assessments. They can check for her biochemical markers such as estrogen levels, progesterone, assess her for other conditions that we see in women like thyroid, issues, thyroid stimulating hormones, because we have noted women with hypothyroidism could also start having similar problems. And to me, she shouldn't give up. The fact that she has had a baby shows that she can get another one. So she should not give up.
All right. I hope, Dorothy, you've been answered. If you feel like you have more questions, also call us back. And even for others out there, 0795045864 is the number to call us live and ask Dr. all these particular questions. So even as you also do that, let me also pose a couple of them to you. The whole wait and watch kind of option that medics prefer. Tell us, as a medic for all these years, is there a specific size of the fibroid that you take a look and say, well, I won't remove it right now. And now this is us getting into the options of treatment. So I won't take out this fibroid right now, so let's wait and watch. And when does that happen? For which particular kind of size?
A lot of women will have small fibroids, very small, and if the fibroid is subcellous, subcellous means it is outside, it's outside the normal uterus. I don't think we need to worry so much about that, because this is a patient who can conceive, carry a pregnancy up to term. I have said the most important thing is they be enrolled in a high-risk antenatal care, and they deliver in a hospital which has a comprehensive obstetric care service, including emergency blood transfusion service, including cesarean section services. So it is not, many women are conceiving and they are not even aware. They have very many children and they are not aware they have fibroids. So fibroids becomes a problem if mostly the submucosal ones, or it's prolapsing in the cervix and preventing conception, causing severe bleeding, which interferes with the normal routine and the psychosocial activities of a patient. Then that time, it is interfering with the quality of life, and the medical intervention is needed, either a medical treatment or a surgical treatment.
Right. Let's pick this call all the way to Kisumu. Karo, habari asubuhi?
Salama sana.
Uko na swali au maoni for daktari?
Niko na swali kwa daktari.
Okay, uliza.
Mimi niko na ujauzito wa miezi 2.
Uko na?
Na ujauzito wa miezi 2.
Okay.
Lakini nimefanya kuumwa na tumbo hii side ya left. Na chini. Salama sana.
Karo, tafadhali mute TV ama uzime TV ndio uendelee kuongea na sisi. Okay, Karo, ukitupata tena mute TV, and to all those who will be calling us live, mute your television and just have it off so that you can have a very seamless conversation with you. Si lazima ujisikie pia. And all that. But then she had brought in a whole other bit of conversation there that I really, wish that you could have tackled on the same. But then back to what we were discussing. A number of medics advise that for certain cases they won't remove the fibroids at that time. They'll advise the patient, let's wait and see how it will progress. So what circumstances is such an advice given?
If the patient has conceived and comes to the hospital, the antenatal care clinic, and you do your routine obstetric scan and see they are pregnant and they are also having an uterine myoma, then what you do is to reassure them and continue monitoring them. You don't have to interfere with it. And also teach them on danger signs. For example, if they start having low back pain, low abdominal pain, bleeding, vaginal bleeding, they should come to the hospital. So it's good for them to know the danger signs.
Okay.
Yeah.
So now, even as we get into, let's say, the treatments, and I'm pretty sure this is, callers will really be, getting into that. Yeah. Let's pick Joyce kutoka Kitale. Joyce, habari asubuhi?
Nzuri sana.
Yes, uko na swali au maoni?
Niko na swali.
Yes, tafadhali uliza.
Sasa nimekaa kwa ndoa kama miaka 5 hivi. Na niko na watoto wawili, but mwingine nilipata home.
Mwingine ni?
Mwingine nilipata home.
Okay.
But mwingine nilikuja nikapata. Basi nimekuwa na shida. Na shida ya tumbo. Sasa sometimes naona sijaishika mimba tangu nipate mtoto wa pili. Okay. Na huyo mtoto ako na miaka 7. Sasa sijaipata mtoto ya pili. Sasa sasa shida iko wapi? Sasa ndio nilikuwa nauliza kama kuna shida. Alafu sometimes naona uchafu mwingine kama nyeupe hivi inatoka kwa tumbo. Alafu sinaanza kunuka, but I don't know, inanuka sometimes sana.
Okay.
Sasa imekuwa shida kwa ndoa. Sasa sijui ni nini. Mara bwana ananiambia nimeenda family, but sijaienda family, yani sijaienda family tangu nizao mtoto.
So asante sana Joyce kutoka Kitale. Okay.
Sawa.
All
right. Asante sana Joyce kutoka Kitale. Daktari?
Yeah, she could be describing another cause of secondary infertility, chronic pelvic inflammatory disease, which can be associated with hydrosalpinx.
Okay.
Hydrosalpinx is they have swelling of the fallopian tubes, fluid filled, and as a result they get into secondary infertility because they are not able to conceive. The tubes have actually collapsed. She could also be having pelvic adhesions, which may be explaining why she's having a lot of pain.
So to cut short, so even as you continue, you could also simplify the medical terms into the layman terms that the viewer can really pick up from.
Yeah, infections like Neisseria gonorrhea infection, chlamydia infections can actually predispose to secondary infertility. What could have happened is that she has accumulation of pus and some inflammatory fluid within the fallopian tubes. Sometimes it causes those tubes to collapse and lose their patency, and therefore it is very difficult for the egg to be able to reach the uterus for implanting.
Right.
So for her case, because she needs to be seen in a hospital urgently, because he's talking of a discharge, the chronic pelvic discharge and pain is it's an emergency.
Does that rule out?
It's a gynae emergency. So she needs to go to a hospital together with her husband so that both of them are evaluated, the swabs are taken, culture and sensitivity is done, the right medication is determined and given to them.
By listening to her, I'm asking now, by listening to her case, will you rule out fibroids instantly, or does she now again need a whole checkup to
you can't rule out fibroids because if you do a routine pelvic ultrasound scan or a magnetic resonance imaging scan, you might be able to find there are also fibroids there. But in her case, she has described clearly that she has a white discharge and she's having pain and she is unable to conceive, more characteristic of a chronic pelvic infection or inflammatory disease.
All right.
Yeah.
Walk us through the factors that are considered when choosing the treatment options, the kind of non-invasive that are there, the hysterectomy, as well as the uterine fibroid embolization. Walk us through the kind of factors that are considered when choosing the treatment options.
I think one of them would be the size of the fibroid as well as the position where it is. I have just said that most of the fibroids that are subserosal, small in size, there is no need to interfere with them.
Okay.
Some of these that are symptomatic and are intramural, you might do laparoscopic myomectomy.
That's the non-invasive.
If they are, you think you can also do uterine, myoma embolization. Those are non-invasive techniques.
Okay.
And sometimes you can do a hysteroscopy and you see that fibroid that is just there.
Right. Let's take this call kutoka Winfred uko Jogoo. Winfred, habari asubuhi?
Nzuri sana.
I hope pali huko watu wanaendelea vizuri?
Hapo salama.
Yes, uko na swali au maoni kwa daktari?
Niko na swali.
Yes, uliza.
Last year nilipata mtoi.
Okay.
But nilikuwa na fibroids.
All right.
Sasa ikabidi wanifanyia CS nikipata mtoi. Wakinifanyia CS wakatoa hizo fibroids.
All right.
Sasa kwa nauliza.
Okay.
Kuna time nalala nasikia hii pad ya left na ndio fibroids zilikuwa. Kuna venye fibroids huwa zinarudi after kutolewa.
Okay, so very important question there. Kuna ingine ama ni hiyo tu?
Ni hiyo tu.
So asante sana Winfred, salimia watu pali huko. Waambie endelee kuwatch TV47.
Tasalimia my husband akiwa.
So Winfred there, a question that I know you had alluded to earlier, but then you can also just retouch it for those who are actually also tuning in right now.
Yes, I had said clearly that people can conceive and go on and deliver with fibroids. All they need is to go to a comprehensive obstetric care use facility, level 4 hospitals and above, where there are emergency services like what he has said, she was able to access a cesarean section service. The issue of removing fibroids while doing a cesarean is not recommended so much. Cesarean myomectomies can lead to severe postpartum hemorrhage and many other problems. It is possible that, you see, the fibroids are not the same size. You can have multiple fibroids growing in the same uterus, but different sizes. Okay. And so the ones of concern are the big size because they could have caused a malpresentation, probably because the baby could not position itself properly in the uterus because there was an obstructing myoma. And as a result, probably the baby was breached. They had to do a cesarean section. Yeah.
Right, and the whole bit of recurring, because earlier when you were telling us how the whole main cause of, rather the common kind of causes of fibroids in your case would really be largely on, let's say, diet, the obesity, and someone has it, but then when they were removed, they probably lost and shedded a number of their weight, and they were at a particular, weight. The weight as well as the BMI was a proper one, as well as the kind of diet they were taking. They really, take a look at how it was at that time. Let's pick this call so that we can actually get to understand the whole recurrence of it. Ivy kutoka wapi?
Kericho.
Ivy kutoka Kericho, habari asubuhi.
Salama, na wewe?
Sisi tuko salama kabisa. Uko na swali au maoni for daktari?
Shida yangu ni kuna kitu ilimea kwa tumbo, side ya right.
Yeah, side ya right,
Inaitwa cyst. Amenisumbua for 1 year. Na nimeenda hospitali karibu 4. Ya kwanza nilipata hiyo cyst kubwa.
Hivi kidogo tu, unaweza mute TV ama uzime ndio tupatane vizuri. Usijisikize.
Sasa?
Yes, umefanya hivyo? Umezima TV?
Nimezima.
Aya, sasa endelea kuongea na sisi. Ulikuwa na maumivu side ya right,
Cyst.
Okay.
Sasa amenisumbua for 1 year. Nimeenda hospitali. Nilienda hospitali, akanipima, akaniambia hiyo imeenda. Na saa hii bado nasikia uchungu, hata amekataa kunirisi.
Right.
Uliza daktari aniambie dawa ndio niende ninunue sasa.
Sawa. Wacha daktari amekusikiza, wacha akwambie maoni yake.
Okay, sawa.
Asante sana Ivy, endelea kututazama.
Thank you. So a unilateral swelling, and she has already gone to a hospital. She has been examined and probably done a routine pelvic ultrasound scan which confirmed it is a cyst. It could be a cyst adenoma. Usually it becomes a problem if it gets into what we call torsion or twisting, such that the cyst itself is unable to get blood supply and it starts getting necrotic. Then it becomes an emergency and it requires to be removed. Most of those cysts can just be managed laparoscopically. A number of them can just be left. You just manage them with analgesics and expectant management. So I don't think it is a big issue, but she has said it is growing big in size. If she has noticed the swelling is increasing, she should go back to the hospital so that they can repeat the test. They can do the MRI, the CT scan of the pelvis, scans, and be able to discuss with her the best mode of management.
Okay. Yeah. Dorothy from Tharaka Nithi, we had talked to her earlier, and she's back on the line. Dorothy, habari asubuhi tena.
Salama sana.
Yes, umeona kama daktari amesahau pali uliuliza ama kuna swali lingine?
Daktari amenijibu na amesema nifuatilie kwa daktari. Sasa niko na rafiki yangu ambaye nimemwambia tu nini, akaniambia ako kazi, nimuulizie swali lake. Amepata mtoto mwezi wa 3.
Okay.
Bruce, yes.
Hii mwaka ama last year?
This year.
Okay.
Bruce, yes. Na akaambiwa ako na fibroids.
Okay.
Swali ni anatakiwa atolewe lini na ako na katoto kadogo kananyonya saa hii?
Sawa.
Ama itakuwaje?
Sawa, asante sana. Ambia rafiki yako endelee kutazama TV47.
Okay.
Yes, actually.
It's not necessary. She already has a child and therefore she has no infertility issues. She doesn't need to be removed, the fibroid. It means they are not affecting her fertility. She can just continue with her routine, make sure the baby is exclusively breastfed, and she should not worry about it.
Sawa.
Yeah.
Aya, Dorothy, ambia rafiki yako asitense akiwa job. And so before, quite a number of the callers were calling in, the question that I had posed was the reoccurrence of the fibroids, despite the fact that someone has lost an amount of their weight, as well as they're checking on their diet. Because earlier you told us this can really be some of the major causes to fibroids. So what if someone actually now checks up on this? Is there a possibility of reoccurrence of the fibroids?
Yes, there is. I have just said that they are usually growing at different sizes. And you'll find somebody with a huge fibroid also could be having a very small fibroid. As a result, if you remove the big fibroids, the smaller ones will also keep growing.
Okay.
And therefore, it's possible for people to have a recurrence of the fibroids.
Sawa. Gabriela kutoka Kasarani anatupigia simu. Gabriela, habari asubuhi?
Hi, Sasa.
Poa sana. I love your voice and your excitement this morning.
Oh yeah, no, it's because this is like my 15th call. I've been calling and I'm like, tuwatarakinizi. Connection yao ni gani yenye course zao ndo zina go through.
Finally. Finally.
Oh yeah.
Finally.
So thank you so much for, first of all, hosting this show. My question goes to the doctor.
Okay.
I am pregnant. It's less than a month old. But I equally have, you have such a lovely smile on the TV.
Thank you very much.
But I also recently discovered that I have a 15 centimeters fibroid.
Okay.
Yenye somehow imefanya sijui uterus ikakaa aje.
Okay.
And I have been spotting all along, and at night when it's you smile, guy, I should stop looking at the TV. Me hata sio watu kuamua tuweke TV on mute.
Okay. All right. Continue. Okay.
So I've been spotting, and at night when it's really cold, I feel as if the inside of my stomach is like tearing apart, and it's really painful.
Okay.
And I do not know where to start from.
Okay.
So if the doctor could advise me on that, thank you.
So thank you very much. Doctor?
She's describing a symptomatic leiomyoma. She has given the sizes around 15 centimeters. That's quite a big fibroid. And probably it is pressing on her bladder. She may be having frequent micturition. She may be having pain while passing urine, low backache, low abdominal pains. And of course, she may be experiencing heavy menstrual cycle, which is interfering with her routines. Her quality of life is decreasing. She needs to urgently see a specialist, a gynecologist, who is nearer where she stays, so that she can be evaluated, and a scan can be done, a hysteroscopy can be done, an MRI evaluation can be done, and they can decide together with her doctor whether to remove it laparoscopically or to give medication or to do what we say the uterine myoma embolization.
Right.
So all those options are open.
Okay.
Yes.
And speaking of options, allow me to fill a couple of them and some questions on our socials Someone asks, hi TV47, salimia daktari na umuulize ile coil inatumika kazi yake ni gani?
Which one?
Okay, they just mentioned a coil.
Okay, yeah, I get them. Yeah, there are some people who use an IUCD with an implant, progesterone impregnated IUCD, like Mirena. They have been shown to reduce the size of the fibroids.
So how does it work? Well, I pose that question, the whole work function of the coil as we pick this. Kutoka Mombasa, Irene, habari asubuhi?
Nzuri sana.
Unaweza paza sauti kidogo. I hope umezima TV, umemute TV, alafu ulize. Yes, unaweza uliza daktari swali.
Okay, good morning daktari.
Good morning.
Anakusikia, endelea.
Yes, good morning.
Endelea, anakupata, ha?
Yeah. Irene from Mombasa. Last week, I had been advised to go for an ultrasound somewhere.
Okay.
Because I have an issue on my left side, especially when I'm with my hubby.
Okay.
I feel like there's something that is, I feel something that is tangible inside.
Right.
So I went to the hospital, nikaelezea daktari, akani advise I go for an ultrasound.
Right.
Then when I went, let me read you the report in the nilipewa. The left adnexal region shows a round hypoechoic lesion measuring 3.6 by 2.6.
Right.
Currently, I have very severe backache. Very severe one, to an extent that I cannot do some house chores, the simple ones.
Okay.
Yeah. So I don't know whether whatever I'm feeling is related to this. Yani nasikia when I'm with my hubby, it is like this something that is tangible inside. I can feel the pain. I can feel it.
Okay.
That is what triggered me to go to hospital and seek some medication.
Right. Asante sana Irene, and quite sorry for that. Yes,
yes, unilateral swelling, which is painful in the right or left adnexa. The differentials would include an ectopic pregnancy, a chronic ectopic pregnancy. I have also said an ovarian cystadenoma, and I have also said you can have hydrosalpinx. It could also be a pedunculated myoma. So she needs to be well evaluated. An MRI scan should be done to see whether any of those conditions could have developed, and appropriate management instituted, which would include laparoscopic surgery, the removal of the cyst or the fibroid or the hydrosalpinx.
Right.
Yes.
Now back to a couple of questions. I'll fill up about two of them. You can keep the conversation coming. We have about a couple of minutes to wrap it up. So the first one, which I had asked earlier, 2047 mtu anauliza, hi TV47, salimia daktari na umuulize coil inatumika aje?
Yes, I have explained it's part of medical management of uterine myomas. For those who don't want surgical intervention, they can be put an IUD, intrauterine device, which has progesterone. An example is Mirena. Also, use of combined oral contraceptive pills has been shown to help, and also to reduce the flow of the menstrual flow, heavy menstrual flow. Antifibrinolytic agents have been used, like tranexamic acid.
All right. Let's pick this call. The first gentleman, since we've started. Robert kutoka Machakos, habari asubuhi?
Yes, salama sana.
Yes, you're the first gentleman to call us live. Tunashukuru sana kwa kutupigia.
Yes.
Uko na swali au maoni?
Yes, I have a question.
Okay.
My question goes to the doctor, and it's about a bulk uterine. Yes, my wife was leo ameenda MRI, kufanyiwa MRI. And before we decided aende kufanyiwa MRI, we had tulikuwa tumeenda ultrasound, akaambiwa akona bulk uterine.
Okay.
And you know, as an African man,
right,
I need to have more kids. I have two, and I want to add another two. So my concern is, when your wife is experiencing something like a bulky uterus. Can she conceive?
All right.
Yes.
Asante sana Robert kwa kutupigia, and I hope now you'll be writing the notes akisema, and now you also tell your wife the same comments.
Yeah, I'm listening. I'm writing notes now.
Is she there with you ama ya ishaenda usi?
Yes.
Is she there with you ama ya alishaenda?
Ameenda saa hizi Nairobi. I'm the one who is in Machakos.
Sawa.
Yeah, ameenda Aga Khan.
Asante sana Robert. Yes, I know you've touched on the same as well, and but then for his case you can answer here before we continue.
If she's already conceiving, they have said they have 2 children, which is a good thing. That means she is capable of conceiving. Probably the evaluation will look at why is it a bulky uterus. Is it because of the rheomyomas? Is it because of something we refer to as adenomyosis, where you find there is this endometrial tissue which grows inside the myometrium? Is it because of endometrial hyperplasia? Hyperplasia is also accelerated growth of the endometrial lining of the uterus, which can increase its size. These are important things to be put into consideration. And magnetic resonance imaging will be able to, is more sensitive, it will be able to pick out what is causing that uterus to be bigger than normal or bulky, as he puts it.
Right.
And then proper treatment can be instituted.
Right. So as we wind up, you've listened to all the scholars, you've picked a particular trend on what the majority really want to ask. You can really share some tips to them.
One thing, I would encourage them to have a good health-seeking behavior, go for preconceptional care and counseling. Okay. Routine ultrasound check would help pick out some of these things we call silent killers, like ovarian cyst adenocarcinomas. It will also pick out those myomas before they become too big, and it will be possible to remove them laparoscopically or to give medical treatment. I would encourage young people to also watch on their diet, watch on their weight. A reduction of their BMI to the normal, between 18 and 25 kilograms per meter squared, is recommended. And it has been shown to improve the menstrual cycle, reduce the risks of PCOS, polycystic ovarian syndrome, and type 2 diabetes.
Right. Yeah. Thank you very much, Dr. Dr. Stephen Gigi. He is a family medicine specialist as well as a medical superintendent, Marago Sub-County Hospital. On this particular conversation, it continues on our digital platforms. We're asking you, do you have any questions regarding all this? And Dr. could you share with us probably a contact that in case they have all these questions, that it can be channeled to you briefly so that we...
Usually, I always tell them I'm a government doctor. I'm a deputy director of medical service. And our hospital is a public hospital. It's in Murang'a County. They're always welcome. And I see them coming there routinely for check. So it will not be hard for them to get me. Because it's a government hospital.
All right. So if they're within there, they can actually visit the hospital.
Yeah, and check on me. I'm usually in room number 22 in the hospital.
So asante sana daktari for all this wise nuggets that you've given us, to all those who have actually called, like Dorothy, Caro, Joyce, Winfred, Ivy, Yulo Kasarani, Irene, and also Robert, and all those who have actually talked to us on our socials. We've posted that question there. You can head there and also interact with us. Something else to interact with us. You're probably a road user. You're actually a road user because maybe even as you take a short break, you'll be heading to the road. You're either a driver, you're a pedestrian, you're a passenger.